This is your national news network, offering news coverage of national and even international hot topics.
Delivering the people with extensive, unbiased, and credible news throughout the world. For everyday stories is coming to an end, and tomorrow marks the beginning of something new. We are here to patrol to the service of the Filipino people. This is Tcwd Patrol! Good morning, Philippines! Welcome back to Tcwd Patrol. Today is Friday, April 29, 2023. I am Meran Dimapilis.
And I am PJ De La Peña.
And we're back to bring you the most latest and controversial news from across the world.
Breaking news! Shanghai City seeks to restrict the local population in 2035.
Mortality rates are decreasing as human health improves.
As childbearing demands increase, fertility rates decline.
Projections of population growth by demographic transitions.
Other consequences linked to changes in demographics.
The Chinese authorities have stated the Shanghai's economic center has implemented changes to control the city's rapidly expanding population to prevent big city disease. Here is Christian Dominic David for the report.
Chinese State Council's official website, by 2035, the population of Shanghai will be limited to no more than 25 billion people, and the entire of land made available for construction will not be greater than 3,000 square kilometers. The city of Beijing likewise intend to limit its population to 23 million people by 2020. The Chinese government is making efforts to reduce the disparities between rapid population growth, available resources, and environmental area capacity that result in probably known as big city disease, which is defined by the state media to include pollution, traffic congestion, and a lack of services like education and healthcare. As of 2021, the administrative territory of Shanghai municipality was home to approximately 24.89 million permanent residents. Therefore, those of our fellow citizens interested in relocating to Shanghai should move immediately.
However, it appears to continued efforts to beautify both cities through urban planning laws, regulating influx of people, are affecting and driving out lower skilled population. They include renovating less affluent areas, gathering up street vendors, closing or moving hundreds of markets, and erecting barriers around licensed eateries, bars, and retail establishments. In November 2017, a fire in Beijing, southern suburbs, resulted in the deaths of 19 individuals. The government then carried out a mass eviction and demolition campaign in response, forcing numerous residents to quickly pack up and leave their houses. Protesters believe that authorities exploited the fire as an opportunity to speed up their plans to push low-end migrant labor out of the city by destroying the illegal buildings, most of which were shops and houses owned by low-income citizens. Saskia Sassen, a sociology professor at Columbia University, claims that the city like Shanghai and Beijing have forcefully built establishments that may be out of their price range of lower-earning middle classes, limiting the availability to the new very high-income middle class, leaving less space for poorer communities. Meanwhile, Dr. Yan Song, director of the University of North Carolina's program, underlines that the large city sickness is not caused by the people but rather by the city's poor management of its urban structures and lack of services. He reiterates that the government should increase public services rather than attempt to drive away the immigrant community if there is overpopulation and lack of resources. The situation of Beijing and Shanghai highlight the need to manage worldwide population growth and the benefits of doing so in a particular metropolis. Nonetheless, implementing such constitutions should carefully consider measures that impact mainly lives without endangering the way of life for those in the lower and middle classes. These regulations ought to be modified so that everyone can be accommodated more fairly. Furthermore, the top cities in the Philippines are most likely to have a big city sickness and may try to control their population to fight back against environmental pollution and reduce increasing demands and accessibility to public services. According to the Worldometer's elaboration of the most recent United Nations data, the Philippines population is 113 million as of March 2023, which is equivalent to 1.41% of the world's population, despite having a total land size of only 298.170 square kilometers the Philippines is the 13th most populous country in the world.
As the contraceptives and abortion is still delicate in Asia's largest Catholic country, since 2000 of fewer individuals have lived in rural areas due to their migration to city areas, according to government figures. In turn, this makes urban areas more susceptible to earthquakes, flooding, and increasing the death toll from natural catastrophes. As a result, the Climate Change Commission promises to address the problem by enhancing preparedness and resilience for disaster. This is Christian Dominic M. David reporting Tcwd Patrol.
The decline in fertility rate is one of the main demographic transitions that occur after the initial phase. Therefore, numerous researchers have proposed various theories. Here is Juliana Esperanza to provide further details.
In the study of Colin Tcwd, marital fertility began to drop in most European provinces between 1890 and 1920, with a median decline of roughly 40% between 1870 and 1930. Most economic theories of fertility begin with the assumption that couples want a particular number of surviving children rather than births per se, because future parents notice an exogenous increase in child survival, and hence fertility should drop. These concerns about parental investment in children suggest that the costs and advantages of childbirth will vary as a result of economic development, which will also have an impact on fertility. Theories are also made that mortality and fertility interact in complex ways. According to Meltzer, increasing survival enhances the return on postnatal investments. According to Merlouve, some of the improvement in child survival is a result of parental decisions to invest more in the health and welfare of a smaller number of children. Other considerations include that it takes a lot of time to bear and raise children. Technological advancement and increased physical and human capital make work more productive, raising the value of time in all activities, which make children increasingly costly relative to consumption goods. Variations in women's productivity have been particularly significant because they have traditionally carried the primary duty of childbirth and child-rearing. Consumption demand has changed towards non-agricultural goods and services, where educated labor is a more crucial input due to rising salaries. Increased education investments follow a growth in the return on education. Overall, these patterns have numerous negative effects. Children become more expensive, their economic contributions are reduced due to school time, and educated parents have higher time values, which increases the opportunity cost of child-rearing. Additionally, parents with better incomes decide to invest more in each child, which boosts the cost of each child and also results in fewer children. Fertility is currently at or below the replacement level of 2.1 children per woman in 60 nations, which account for 43% of the global population. Of these, 17 are less developed countries, whereas the other 43 are more developed. Nearly all industrialized nations and many nations in East Asia, including Taiwan, South Korea, and China, have total fertility rates far below replacement levels. It is now unclear whether fertility will continue to decline, increase toward replacement, or remain at current levels in a large portion of the world. Fertility has declined to levels much below the 2.1 births per woman that would merely replace one generation with the next. This is Julian Esperanza from Tcwd Patrol.
Significant changes have been brought about by the drop in mortality rates, which have sparked a global demographic shift that is transforming people's economic and demographic life cycles and restructuring populations. Here is Kaziak Andres for the report.
The world's demographic transition began in Northwest Europe when the death rate started circularly fall around the turn of the 20th century. However, the drop in mortality started later in the 20th century in many low-income nations of the world, and it then substantially increased after the World War II. The first stage of mortality decline is a result of drop in infectious and communicable disease caused by air and water. It was the result of the germ theory being discovered between roughly 1850 and 1920. The hypothesis was created, validated, and made widespread in Europe and North America. This approach changed the way medicine was practiced and made it easier to understand what caused particular disease. Therefore, There has been a large decline in death rates as a result of innovation in preventive medicine. Historically, people believed that their body care set them apart from the lower classes. When the majority of the population's income increased, the ability to provide equipment for cleanliness improved personal hygiene. Nonetheless, frequent bathing and hand washing had become customary and widespread by the middle of the century. The development of nutrition is a significant additional aspect in the early stages of expanding life expectancy. Because of improvements in transportation and storage, regional and global food markets were able to be integrated, distributing supplies despite regional variation in agricultural output, which reduced famine mortality. Unfortunately, as HIV/AIDS arise in Africa, according to United Nations projection, over 2/3 of Africa adolescents who were 15 years old in 2000 would become HIV/AIDS before they turn 50. In the 35 most affected African nations, the average life expectancy at birth has decreased by 6.5 years since the late 1990s. This effect is expected to increase to 9 years between 2000 and 2005. The additional main exception to the generally favorable recent trends in mortality found in countries of Eastern Europe and former territories in Soviet Union, which have experienced declining life expectancy over the past 2 or 3 decades before the difficulties of the transition market economies. This is Kazia Andres, Tcwd Patrol.
Population growth projections have been determined using demographic data from the past trajectory patterns, maintained by various organizations. Alexandra Alcaraz is here to give us more information.
The combination of fertility and mortality determines population growth between 1950 and 2050. The actual and projected trajectories for the more, less, and least developed countries are plotted. One is a trajectory for Europe from 1800s to 1950. The endpoint of this trajectory in 1950 is quite close to the starting point for the more developed countries.
The United Nations and the U.S. Census Bureau regularly releases forecasts of the world's population. The main current forecasts from the UN anticipate that the world's population would rise by 50% from its current level to 8.9 billion by 2050 and just under 9.5 billion by 2100. These projections are compatible with certain other worldwide projections. The National Research Council, on the other hand, concluded that there is a 95% chance that the actual population in 2050 will fall between 8.2 and 10.2 based on the detailed review of preview predicting errors by the United Nations.
Currently, the average individual lives in a nation with a total fertility rate is 2.3, just slightly higher than the 2.1 fertility rate in the United States. And the median life expectancy at birth is 68 years as compared to the 77 years in the United States according to Wilson in 2001. This is Alexandra Alcaraz, Tcwd Patrol.
Other consequences linked to demographic transition regarding societal, economic, and political objectives have emerged. We have Aisel Martin standing by to give the report.
Numerous changes will be made to the world's population as a result of the 3 centuries of demographic change between 80s and 2001. The most noticeable changes are the increases in global population from 1 billion to 80s to perhaps 9.5 billion in 2001. Although this long-term estimate remains highly uncertain, partly because of uncertainties about future fertility. Many more developed countries already have negative population growth rates, and according to the United Nations projection that between now and 2050, the population of Europe will fall by 30%. However, plenty of other changes will also be brought about in terms of family structure, health, institutions for saving and supporting retirement, and even international flows of people and capital. At the level of families, the number of children born declines sharply and childbearing becomes concentrated into few years of a woman's life. When this change is combined with greater longevity, many more adult years become available for other activities. So far, these modifications seem to be rather widespread. However, whether the age at marriage rises or declines and whether childbirth is concentrated at younger or later ages tend to differ from setting to setting. And patterns are still altering even in the communities that are furthest advanced in the transition. The quality-quantity trade-off, which may also be one of the reasons parents lower their fertility, is reflected in the fact that parents who have fewer children can devote more time and money to each child. The economic and social effects of aging, as well as the general well-being of humans, heavily depend on trends in health, vitality, and impairment. The huge reductions in retirement age, which for American men decreased from 74 years in 1910 to 63 years in 2000, have increased the economic strains brought on by the increasing number of elderly people in the more developed countries. Since the 1960s, earlier retirement has been more common in industrialized countries due to generous public pension plans that allow for early retirement and significant implicit taxes on those who keep working. Population aging will put more financial strain on publicly supported healthcare system that it will on pension systems in several nations, notably the United States. The overall percentage of US in the absence of reforms, the GDP spent on government programs for the elderly is expected to nearly triple over the next 75 years. While the public expenditure percentages for children and individuals of working age are expected to remain relatively unchanged. Childbearing generates enormously positive fiscal externalities due to population aging and the expansion of age-related public transfer systems for pensions, education, and health. As a result of low fertility and extended life expectancies, the global population is aging dramatically, which is an expected last phase of the demographic shift. It will present significant political and economic difficulties. Nevertheless, high-income nations with aging populations, high capital intensity, and diverse cultures should have a positive quality of life, provided that our institutional frameworks are sufficiently adaptable to let us modify our life cycle plans in response to changing conditions and that we are prepared to pay for the health insurance and longer retirement that we seem to desire. This is Aizal Martin, Tcwd Patrol.
And that concludes the news that we have gathered as of today.
Again, this is your National News Network offering news coverage of national and even international hot topics. I'm Mero Andy Mapilis, and you are watching Tcwd Patrol, delivering the people with extensive, unbiased, and credible news throughout the world, where everyday stories are coming to an end. And tomorrow marks the beginning of something new. We are here to patrol in the service of the Filipino people. Tcwd Patrol.